What are some of the top priorities within the strategy office at the system today?
The number one is to continue our journey in having more diversified sources of revenue and margin. The specialty pharmacy is a great example. We're looking at lab services. We are not meeting the demand that comes our way sometimes outside our care delivery system. So we see that as an opportunity. I firmly believe that retail health is an untapped. Thinking about, women's health, there is a huge gap in how we in healthcare have, in my opinion, humbly failed to respond to the needs of the women going through perimenopausal phases, pre, during, and post. Uh, and what has happened is in the absence of good responsive care, holistic care, people turn to, their exercise and yoga studios to give them medical advice. You go to TikTok and Instagram, you go to these health spa resorts for thousands of dollars in the hope of, being heard, understood. So we see this as an opportunity for our women also to do some good with evidence-based, non-toxic methodologies to help in that space, but also to capture a market that is untapped right now. And we're approaching it from a very consumer-driven sense.
Welcome to the Analyzing Healthcare podcast brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level. All right, welcome to the next Analyzing Healthcare by Scale Community podcast. I am pleased to be joined today by Sameer Badlani, the Chief Strategy and Digital Officer for Fairview, a integrated health system in Minnesota. Sameer, welcome to the podcast.
Thank you for having me.
So maybe for those that are less familiar with Fairview, why don't we just begin with a quick overview of Fairview in terms of the footprint and the presence you have in the Minnesota market?
Absolutely. So Fairview has been serving the Minnesota communities for about 100 years, and we have 10 hospitals, a couple of hundred clinics. We are a dominant provider in the Twin Cities market, but then also have presence in the suburbs and many of our rural communities as well, especially along the Wisconsin border. 34,000 employees, partner with employed physicians, academic physicians, and independent doctors very happily. And we serve about 1.2 million patients a year, individual patients. We, are really proud of the service that we provide to our community.
So I don't profess to be an expert in Minnesota healthcare, but from the little I know, it has struck me as a somewhat of a unique market. I know there's some independent groups that have grown to be quite large and have remained independent. So that's something that stood out to me. And I believe the payer landscape in Minnesota has also had its nuances and unique attributes. So maybe similar question from a Minnesota market landscape perspective. Can you give us an overview of the market landscape from a payer perspective, from a competitive landscape perspective? We'd be curious to hear your thoughts.
Yeah, absolutely. Minnesota has been a very successful market from innovation in the healthcare space for a while. If, many people don't realize, we have a very large number of Fortune 50 companies. Medtronic was started here. On the other end, you have, on spectrum, you have Target, you have General Mills. So there is a lot of, innovation in the medtech space, but in entrepreneurship, large scale entrepreneurship as well. United Healthcare and Optum are also headquartered here, even though they're not a dominant, payer in the market. They recently moved into the market about a couple of years ago. We have, really good healthcare delivery systems like Fairview in the Twin Cities, but then you also have, Mayo that started in Rochester about an hour plus drive from here. So it's been a very robust space for doing new and innovative things and staying on the cutting edge of healthcare delivery. When it comes to the healthcare economic side, it's a very tough market to be in. And the way we like to describe it, what our CEO James Hereford describes as the 2%, 4% problem, which is that if you take the COVID years out, at that point it was worse. Healthcare inflation goes up by at least 4% in our state, between supplies and labor, broadly speaking. But the payers hold a dominant position because for the longest time there were not that many payers in the market, and even now it's one or two payers hold a monopoly. The level of rate of increase in premiums paid to us is only about 2% on an average, which is very low and different compared to the rest of the market. What that does is if you are, we are about a $9+ billion company, but let's say 9 billion for easy math. On Jan 1st, you already have $180 million to go find before you can have $1 in net operating income to declare. So we're always on this hamster wheel of doing improvements either through growth or through efficiency to achieve that 180 million and then declare beyond that to have some level of profitability. And yes, we are a nonprofit, but even nonprofits need to make money. I think that sometimes is not, comes through in how we describe ourselves. And we don't need to make 10%, 15%, or 80% like, med device or medtech makes, or pharma makes 25%, and so on and on. But we need to make at least 3 to 5% NOI in a steady state so that we can reinvest the earnings in our infrastructure, refreshing or strategic growth opportunities to serve our community, to be stable for another 100 years to serve the communities that depend on us. So that's the second, interesting characteristic of the market, which is important to understand. The third thing I'll take, from the strategy office lens, a demographic-based approach. So the state's population is not increasing. You can go to states like Florida, Texas, Arizona, where you see a high birth rate, as well as comparatively to Minnesota, as well as a lot of net in migration into the state for various reasons. It's, you could say it's the weather, it's the taxes, or, big companies moving into that space, whatever, the reasoning might be. Our net in migration is keeping our population levels flat. Birth rates have decreased by close to 8 or 9% in the last decade and expected to go down by another 6% in the next decade. So what we are facing from a demographic lens is what, certain companies call the silver tsunami, is that the population will stay at the same level and keep aging. And we expect that by 2050 or 2040, I forget the exact year, is predicted that more than half of the state's population will be above the age of 65. So that's another interesting element about delivering healthcare in the state.
So I want to go back to the second point you made about the payer landscape, because it sounds like there's concentration in a single payer or a small universe of payers, and that's put contained revenue increases on the supply side or for the supply side. You also mentioned that there are a large number of large employers in the market. And I'm wondering if the presence of well-organized, self-funded large employers is also a contributing factor to capped increases, if the pressure truly comes from the payer, or if the fact that these well-organized employers are in the market also contributes to downward pressure on reimbursements.
Yeah, I would say we have a lot of highly successful large businesses, but across the spectrum, my understanding is that they are not the dominant groups, in terms of employee base. Yes, they're large, but we have a very successful, robust small business to medium-sized business economy as well. And absolutely, as an employer, you are interested in keeping the cost of healthcare down. But, and we are self-funded and take our own risk. You also want your employees to have access to good healthcare, which I define as not just high quality, but high safety and great experience as well. And access plays through all of that. And then you also care about keeping them healthy as well and productive. So those are the three things that, an employer thinks of. In our opinion and analysis, the pressure is from on the payer side, where it's a 5 to 6% margin business, and although a lot of their marketing seems to suggest that they're there to maintain the cost of healthcare down, you only have to look at some of their SEC declarations as a for-profit company to see how many businesses like PBMs and other businesses they are in, which are adding to the cost of healthcare. So the complete story often gets lost in that marketing blitz.
So I think that context sets us up well. So you've got a large health system with a meaningful market share. You've got the market dynamics that you just mentioned. Sounds like a fairly large commercial base with capped reimbursements given the payer dynamics. And so, some headwinds, some tailwinds. In that context, Fairview Health has gone through pretty significant transformation over the past couple of years. My understanding is that the hospital turned an operating profit in 2024 for the first time since 2019.
Hmm.
So, firstly, congratulations.
Thank you.
And would love to, as a chief strategy officer, get your perspective on some of the contributing factors beyond what you've already mentioned that led to the operating losses, and then learn a little bit more about the initiatives that led to a change from the operating losses to the profit in 2024.
Absolutely. We're really proud of our turnaround. It's been led by our CEO and, I would say operations, finance, our transformation office, our pharmacy business all have led to us being in this, I would say, safe zone of now trying to stabilize our turnaround. If you add up, from where we were at the end of 22 into end of 24, it's almost a $600 million turnaround. Now, I want to clarify, it's not that we made 600 million, but from the negative point where we were, you add the inflationary 2%, 4% that I add, it's a really nice storyline. I would say the prime reasons for us that led to where we found ourselves was number one, the throughput in the hospitals was not moving as fast as it's moving today. Just to give an example, in at the end of 24, saw 7,000 more inpatients than we were seeing at that point in time in 2 3 years before that. Then obviously COVID happened, which
Was the throughput, the change in throughput, is that just better management, more accountability? What is it that led to that
It
change?
was everything. It was a cohesive focus on length of stay. It was to ensure, and this was a partnership between operations, transformation office, finance, and the clinical workforce as well. Simple things like if you know your patient is going to get discharged tomorrow and they need an echocardiogram before they go, let's make sure we try to get it on day -1 or early in the morning. So what do you need to get the patient out by 10 a.m. or 11 a.m. so that the bed is available to take the next patient who's waiting in our emergency department? It's not like we had to go source more patients. Our EDs are, always packed with boarders. Unfortunately, from their experience lens, it was things like, your patient is going to leave tomorrow. Do they have a ride? Rather than trying to figure that out at 10 a.m., if they have a ride, you figure that out, 2 days before that. So there were initiatives like that. A lot of really good data and analytics to add some layer of prediction that this patient, this disease is more than likely to go on day 3. And then, of course, focused care clinical pathways that really leverage technology from predictive analytics, from better note writing to better coordination and follow ups with all the people involved. So I'm not doing justice to the level of effort. There were almost like 25, 26 discrete work streams that played out over a year of 2 3 years, and in partnership with ops clinicians, this has been a fabulous turnaround. The other things that we looked at is reducing waste in the ecosystem. So how do we ensure that the projects that we are doing, the supplies that we are leveraging, are being used to their best capability? So typical operational efficiency measures were applied, and that also yielded a lot of benefit. Special call out to our finance colleagues. I think the financial FinOps reporting that we had pre 2019, it's a much different day right now. We're able to find areas of opportunity on a weekly basis versus sometimes they got hidden in the kind of dashboards they were available at that time. The one other thing I'll add is contracted labor. That was a significant driver starting in 2019 and definitely well into COVID, where typically, and I may not get the numbers exactly right out of memory, but we used to spend about 3 or 4 million in contracted labor for overtime and missing positions in nursing and other clinical tech areas. That went up almost X during the COVID time. There are a lot of articles you can read on how the labor shortage and people choosing to be contracted versus employed because of the higher income that they were generating and having to work less, that significantly contributed to it. So the labor cost, especially on the contracted side, really ballooned up in the COVID years. And again, focused effort in partnership with HR and operational leaders and our CNO helped bring that down to a reasonable level.
When you look back on this transformation that you went through, and you think about the assets that the hospital owned then versus now, Have there been any changes? Are there any assets or service lines that the hospital got out of or divested or worked through partnerships rather than ownership? Conversely, are there any new service lines or assets that you've incorporated into the health system to allow you to? Healthcare leaders, if your revenue cycle management is underwhelming you, it's time to rethink your current suite of solutions. Scale Healthcare's AI-powered RCM solutions are purpose-built to protect and accelerate revenue across the entire lifecycle. Denial Shield is an AI solution that proactively prevents and automates the resolution of denials, stopping revenue leakage before claims are even submitted. Front Desk Shield supports preclinical, administrative, and front-end RCM functions, incorporating eligibility, prior authorization agents to eliminate friction early in the patient journey. Revenue Shield maximizes revenue by automating coding, charge capture, and revenue integrity functions, ensuring accurate and complete reimbursement. Together, the Shield suite helps organizations reduce operating costs, capture missed revenue, accelerate cash flow, and increase productivity without ripping and replacing existing systems. If you're ready for immediate ROI and measurable impact, visit scale-healthcare.com and see how the Shield suite is redefining AI-powered RCM.
Yeah, great question. I think, when I say profitability, we are right now aiming to end this year at 1% profit. So I want to, be very humble about this, that this is not like Wall Street level profitability. We have
No, but I
gone from
think, and
red
I
fewer.
appreciate that clarification, but I think, profit is an important part of a sustainable operation where you can invest in
Invest. Yeah,
performance, invest in care. And so, I'm not, and I think the clarification that you're making is super important, but I think also, it's not a bad concept to pursue. I think, what's scary is
absolutely.
not
Yeah.
sustaining yourself at a loss. So,
Yeah,
duly
and
noted.
I like to speak, from the nonprofit lens of the profit and the growth we want to drive from a lens of sustaining the business and service of the community. And we're talking about very humble numbers here. But what is super important for us is to really think about what are we good at and what do we need to have a partner to deliver value to our consumers. And that was the lens we looked at. So one of the businesses that we got out, I forget, it was 2020, was home health, and it's a very important part of the care journey of a patient. And we felt that we couldn't put as much focus on it as we had to put on other sides of our business. So that was one that we spun off with a partner. The second one is around behavioral health, which again is another example of it was already growing as a disease set in our community, and COVID pushed it higher. And Fairview, as an example, treats more behavioral health patients than other providers, and definitely way more than Mayo. I think Mayo does not even touch behavioral health, to my knowledge. And we proudly serve this population. But we also realize that we need a partner to do this more efficiently. We don't want to walk away from the responsibility we have to our state in this matter. So we partnered with Accent Care, who's a nationally known provider in this space, and have a JV in launching some of these capabilities. And the first hospital that is focused on behavioral health just went live. So we're still taking care of the patients, just doing it in a different way. The third example I will say on a different vein is historically we have been very efficient and sophisticated in the specialty pharmacy business. And what we have done with that is we have created a subsidiary of Fairview, which is to help other healthcare organizations do good in the specialty pharmacy space. So it's a consulting and services business that uses what our pharmacy leaders have learned and deployed under Bob Beecher for the last decade plus, and then go to the market and provide that as a service. So it's a diversified revenue play as well as building on your strengths. And I think any business out there does the same thing. Healthcare, in my opinion, is starting to do more of that. You look at companies like Tenet and others, they bought an ambulatory surgery center management company because they realize that's where the market is going, and they need to find businesses with higher margin than less to then redeploy into the core mission of taking care of their community.
Yeah.
So we are on the same path.
So it's interesting. You mentioned three examples, and I don't know if this was intentional or not, but it sounds like each represents sort of a different model of
Yeah,
how you
flavor.
optimize performance. So in the home health case, it sounds like you exited that service line entirely. You work with a partner, but there's no ownership sharing at the home health side. So, that's model number one or scenario number one. Two was behavioral health, where it sounds like, again, you rely on a partner who's an expert in the space.
It's more of a joint venture model.
There's a joint venture.
Yeah, not that we don't have, behavioral health beds right now, but it allows us for another pathway to take care of our patients. And at the same time, the reason I love this example is we also deployed what we call EMPATH, which is a very innovative approach to dealing with patients who come to our emergency department with a potential healthcare, a behavioral health crisis, because it's you don't really have to have a lot of imagination to, uh, agree with this. When you're having a mental health or behavioral health crisis, busy, loud, emergency department is the last place where you'll find mental peace and hopefully a good resolution. So almost always, the experience of trying to get that care in a busy, difficult ED will send you to a much higher state of care needed and get admitted for a long acute inpatient stay. So, anybody who's listening, I would urge them to look up our empath unit, EMPATH, that we have launched in a couple of sites. And what it does is very close to our ED. It takes the best of, integrative care, a calm and soothing space, but a much higher level of care than ambulatory and ED, less than acute, provided in a timely and impactful manner, which then de-escalates the crisis that the individual might be going through. So that's been one of our really good innovation in conjunction with a business model change that has allowed us to continue serving the patients that we want to serve in a more efficient and also clinically relevant way.
And then you've got scenario three, which was the specialty pharmacy, where you found something that the hospital was doing really well, a core competency where you excelled, and you found a way to double down and turn that
Yeah,
into an
absolutely.
ancillary service or an incremental revenue generator for the systems. Three really interesting flavors, that required the hospital to have good awareness of what it excelled at and what it needed help in, and then good flexibility to be able to act on it in three different creative manners. So,
Yeah. And we're
very
looking for more examples and variations where we'll continue doing this.
So now here we are today. The hospital sounds like it's on more stable ground, maybe slightly retooled for the current times. What are some of the top priorities within the strategy office at the system today?
Absolutely. So, the number one I would say is to continue our journey in having more diversified sources of revenue and margin. The specialty pharmacy is a great example. We're looking at lab services. It's another one of our strengths. And, we are not meeting the demand that comes our way sometimes outside our care delivery system. So, we see that as an opportunity. And we are thinking of other examples like that. Within the diversified, I firmly believe that retail health is an untapped opportunity, at least in terms of scale. And by retail, I don't mean the retail primary care examples that we saw come and go in the last 5, 7 years. All of them got sold for insane valuations, and almost everybody who bought them is taking a downgrade on their initial value. But thinking about, women's health, that there is a huge gap in how we in healthcare have, in my opinion, humbly failed to respond to the needs of the women going through perimenopausal phases, pre, during, and post. Uh, and what has happened is in the absence of good responsive care, holistic care, people turn to, their exercise and yoga studios to give them medical advice. You go to TikTok and Instagram, you go to these health spa resorts for thousands of dollars in the hope of, being heard, understood, and getting an answer, and then hopefully some, remedies that help them. So we see this as an opportunity to, number one, do better than we have in the past for our women, also to do some good with evidence-based, non-toxic methodologies to help in that space, but also to capture a market that is untapped right now. And we're approaching it from a very consumer-driven sense. What I mean by that is historically, healthcare would do really good market analytics and say, hey, there's an opportunity in orthopedics. We should have more knee specialists because knee surgeries are in demand. And we would go off and running. In this case, we are sort of holding back to say, it's not good enough to say I already have a few specialists or capable people, providers in this space. I just need to put it together differently and market more differently. We're going out and we just completed a study with a group of women who are kind enough to help us through this. Say, if you were to get care today for perimenopausal care, how should it look like? What should it entail beyond seeing a doctor and a nurse? And what kind of a setting would you like this to be? And it's not just digital and physical physical. Even within the physical, there is a reason, if you look at the Twin Cities market and across the country in orthopedics, the care is given by private groups who have really high experience retail like centers for physical therapy, surgery, standalone with really nice parking and so on and on. I mean, if today we wanted to get into the orthopedic market, unless you are going to put up a capability that matches the experience, not just the quality and safety and clinical competence and capability, but the experience of, in our market, the Summit or the TCOs of the world, you are not going to stand a chance. So we're bringing that humility in how we want to respond to what we perceive as a really good opportunity in perimenopausal care slash integrative medicine. And that's what we are working towards as.
So to clarify, the execution or go-to-market approach is in collaboration with a partner who specializes in those areas, or directly through building it
We
out
haven't,
in-house?
yeah, in this case, in orthopedics, we just declared a partnership with Summit because we recognize that alone we cannot do a good job for many reasons. The market's saturated, even to attract the clinicians, and they need our infrastructure. We need their approach and infrastructure. So it's a very symbiotic partnership with Summit, and they have been a really good partner for over a decade. So it's building up on. In perimenopausal, we haven't landed that conversation yet. But what I'm trying to emphasize is the go-to-market approach is equally informed by feedback from the consumer beyond what the market analytics shows as a potential opportunity.
Any lessons learned from, like, yeah, it's making me think about the home health example, where there's a need for home health, but it also is a different discipline or a different muscle to sort of build and develop a different expertise. And it sounds like in the case of home health, it was one step too far removed from the core expertise and core
At that point
skills.
in time, I would say if we were doing it today, who knows, we might have come back with a slightly different approach. But at that point in time, it was absolutely the right decision.
Fair enough. Fair enough. So it's
Yeah.
a
So
question of
in
time.
perimenopausal, to answer the question directly, we are not assuming that we are definitely going to do this with a partner or just outsource to a third party and just, co-brand, or we're going to do this ourselves. Right now, we are in the listening and understanding mode of
Understood.
what our patients are telling us they need.
So maybe that's a good segue to talk about another topic of engagement and alignment with your provider ecosystem. So what is Fairview's strategy for its provider network? I've heard partnerships in the orthopedic service line, obviously the behavioral health service line we already covered as a joint venture relationship. What about primary care? What about all the other specialty
Yeah.
cares outside of ortho?
Absolutely. So we have one of the largest primary care groups in the state. So that's a big strategic advantage we have. And so our goal, and this is work led by a chief medical officer and chief operating officer, is to be the most desirable working partner from a hospital lens for the physicians in our community. If you are an academic physician, we want to be the employment home of your choice. If you are an employed, partner of choice. If you are an employed physician, we want to be the employer of choice. If you are a independent doctor or a group, we will figure out how to work with you and create contracts and systems that do justice to both our objectives. And that has really worked well for us over the last 2-3 years, where a lot of physicians who were independents or working for other health systems have found this approach of ours to be to their liking. We have always firmly believed that a physician, and me being one, I've seen it. I've sort of lived a little bit of this, not the complete life cycle, but a little bit of it, is at different times of your career, you choose to have different kind of employment arrangements, let's call them that. And we want to be there for all those variations and do our best in making us a very desirable partner to work with. We look at this as a partnership. One of the things I learned early in a previous role is an employed physician can terminate their contract and next day work with you as an independent contract in the same building, seeing the same patients under the same insurance. So it's to our advantage to be amenable to the career decisions that a physician or physician groups want to change and find common ground and alignment. And kudos to our chief operating officer, his team, and the chief medical officer for enabling that.
So again, really knowing what it is that your expertise is and where you excel, and then being confident and comfortable enough to be flexible for different scenarios within that paradigm. So employment, and academic employment, both fairly straightforward. I'm sure there are nuances to the agreements and how you align incentives, but I think, employment is a concept that's familiar. In the other scenario where you're partnering with independents, what are some flavors of what that partnership looks like? Is it just admitting privileges, or are there more formal, partnerships, more
Yeah.
holistic partnerships?
Yeah, absolutely. So I would say we now have a very sophisticated approach to this. Obviously, admitting privileges. We also have a clinical integrated network called FPAN, Fairview Physician Associates Network, where they can come in through that, where we are able to extend our payer agreements, but then also, request partnership on quality and other metrics as well. Those are often very valuable. We've also taken the approach over the last couple of years to really bring independent doctors into the leadership and decision-making infrastructure we have. So we have, the representative of independent doctors elected by them, sitting on our board. It's not that, the board is completely separate from a partnership with our independent doctors. Our medical executive committee for the community and the academic doctors ensures that we get the voice of independence in a very meaningful way, and they are in leadership positions with us as well. And this is at the corporate level as well as the local hospital level as well. And that allows us to learn from them, for us to communicate effectively what we are thinking. And we feel that transparency in communication builds trust. Often when we disagree with a decision that anybody takes, it's because we haven't seen the journey to get to that decision or understood why and how they got to that decision. And this has allowed us to do things differently. We have all kinds of flavors of partnerships with independent doctors and large groups as well. I shared the one that with Summit, which is really awesome, and really excited about the mutual benefit to the two organizations as well as to our patients that we are bringing and want to do more of. So again, really excited about what the future holds for us.
So it sounds like lots of different partnership models on the provider side. Any other strategic partnerships that the hospital either is participating in or considering? So, for example, relationships with the large employers that you mentioned,
Yeah, we're
relationships with
exploring.
other, device companies and things of that
I
nature.
would say they fall into three categories, and I'm because they're in such early stages, I'm unable to get into specifics like names and what exactly are we wanting to achieve. But I divide them into conversations with healthcare peers, conversations with big pharma or medical device companies, and then conversations with technology companies as well. We recognize that we have certain skill sets and we are unable to move fast in every domain as we want to. So if you look at a partnership with a payer, when you align incentives and you are focused on innovation that helps the patient, it allows a care delivery system to shift left on the payment dollar, go higher in the premium dollar. Right now, healthcare delivery is really late in the process of impacting the care journey of the patients and how healthcare dollars get moved into the ecosystem. So if we are able to do more preventive care or more innovative care in partnership with a payer partner or an employer, we bring the cost of healthcare down, the employees get healthier, and economically both partners are held equal in the upside that that brings. If you look at partnerships with a medtech or pharmaceutical company, we have a lot of data and we have the relationship with our patients. How can we partner together to deploy innovation that helps them create more meaningful devices or meaningful interventions, and us being partners in its delivery or development, can we get some upside on the intellectual property side, but also by being first in the market, differentiate ourselves from our competitors. When it comes to partnership with the technology companies, it's, these days it's all about artificial intelligence. You only have to look at what Google or OpenAI and others are spending. There is no healthcare organization that can spend that much money from an absolute number or as a percentage of their revenue in creating meaningful innovation in this space that creates value for the organization and the customers that we serve. So there again, partnering with somebody who brings in the tools, the technologies, the algorithms, and we bring in the data and the healthcare context together, I think we'll move much faster in what we want to achieve.
Yeah, I mean, it's interesting. I mean, I have a sort of a blocking and tackling question. You're covering a lot of territory. You have successfully implemented and integrated a lot of change, and have more that you're considering. And it sounds like the system has a receptivity to trying different models, and so it's not a one size fits all approach.
Mhm.
How do you resource the organization to prioritize what to tackle, to vet the partners that are really good partners versus those that, are just a distraction, and to execute on the partnerships and initiatives that, you've taken under this umbrella. It sounds, because like I said, it is quite a bit.
Yeah. My reflection on that is yes, it's a lot, and it's been achieved over a span of 5 years by a very focused, disciplined team. And, I have the privilege of representing all of them in this conversation. We have a lot of really devoted, intelligent, and hardworking leaders, and it's a journey that at least what I'm representing is at least 5 years worth of work from focusing. We are becoming more and more clear about how we define value. And one of my challenges with being in healthcare for the last 20, 25 years is we love trying out we have the shiny object disease, and we have a very bad case of FOMO, a fear of missing out, that Cleveland's doing it or Mayo's doing it, so we must do it. It must work. And we never go back and found did they stop doing it or what did they learn. So we've become better over time, and still, we'll get even better. Is to be really sure that whatever we want to try, do we have a clear understanding that if it works, what value will it create for our business, our customers, and our employees? We look at it from all three lenses.
So despite taking on more, you've actually become much more disciplined and much clearer about, again, this continued theme that I keep bringing up. But where do you excel versus what's best
Yeah,
to
where
leave
do you
to the
put your
side?
attention units? And I will still submit that we need to get better, but compared to 7 years ago, firmly believe and state that we are way more disciplined and focused on ways that we add value. And we also are learning to walk away from things that don't work in a more effective manner. One of the jokes I like to crack is healthcare has more pilots than the airline industry. And, we love starting pilots, but they never end, and 2 years goes by and they become workflow. So how do we learn what we need to learn, fail fast and stop it and move to the next iteration of what we need to do? And that's also starting to help our growth engine.
When you look at all that is underway, whether it's pilot phase or idea phase, and you think about the next 24 to 36 months, which areas of pilot or experimentation are you most excited about that you think are going to most move the needle for the business in any form, whether it's, patient care, patient experience, financially?
Yeah, I'll use a larger denominator to pick from. We're excited about the growth we are seeing in our specialty pharmacy, services. It's called Fairview Pharmacy, FPS, Fairview Pharmacy Services. It's a national growth engine for us at this point in time. I'm excited about a similar but smaller opportunity with our core lab business in being able to offer our excellent lab services to others. I'm excited about partnering with an ASC management company. We're still in the contracting phase, so I can't declare who it is. Now we want to partner with them and grow our ambulatory surgery footprint in the state and perhaps nearby states as well, because a lot of care is moving from acute to ambulatory, and we see a lot of potential in that space as well. The other things that I'm excited about is healthcare is finally recognizing that when we call ourselves integrated delivery networks, what it has become is we have a little bit of everything. So part of our journey over the next 5 years is to become more focused and do slightly fewer things, but do them really efficiently with high quality, high safety, and retail level experience so that patients will have a great access and great outcomes when they come to us. And that will mean, all the 3, 4 flavors that I spoke about earlier, we will need to do more of that. And if we can provide a particular service to you, it is our responsibility to get you the best service provider for X, need, so that you never feel like we say, oh no, we don't do that. Please figure out how you get care for that particular need that you have.
Yeah. Maybe
That's
last
going to be our
question.
journey.
Last question I'll pick up on. You mentioned the word integration. So as you have this ecosystem of partnerships and different models for how stakeholders in the market interact with Fairview, how do you maintain a certain level of consistency, a certain level of integration, a certain level of data interoperability? Are these partners all using the Fairview EMR? Are there other strategies you have, so that when somebody is coming to Fairview, whether it's, main campus proper or a Fairview partner, they can expect a certain standard of care, and so that you as the health system have all the benefits, direct and ancillary, that come with managing and having purview into the holistic episode of care?
Yeah, we've made great strides in most of our care delivery sites, having a single EMR and the right data and analytics infrastructure associated with. Now, of course, because we partner with amazing doctors in the community, they all are not on the same platform. So we're always working to see how can we create meaningful connectivity that does not require all of us to be on the same instance of the same EMR. I have very strong bias. I'm just going to say it that we sort of lost the real purpose of interoperability about a decade ago, where it became that everybody needs to have access to all the information from everybody from every clinical episode, versus it should be that I am with Dr. X. What is the meaningful, impactful data or insight rather that needs to come from all my other healthcare episodes across the country to inform and guide my current need? And that's what we are more focused on right now, is how can we provide connectivity that is meaningful versus just designed to comply with the requirements that meaningful use has put on us. So it's more about being purposeful rather than we will only get value and interoperability when all of us are on the same instance of the same EMR. I think we went too far.
Yeah, a good place to end. And again, it brings us back to what I keep hearing from you, which is, knowing who you are, knowing what you need, and making sure you get that, but not necessarily going, well beyond that for superfluous needs or superfluous services where you're not positioned to excel. I really want to thank you for a very
Thank you.
interesting overview and conversation. Lots of interesting initiatives that you've been able to tackle and succeed in implementing, and sounds like a lot more to come. So I wish you luck, and I really appreciate you taking the time.
Thank you for this opportunity.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.